In this video, I will be discussing the 12 cranial nerves and the roles and functions they play in the human body. Our cranial nerves are pairs of nerves seen at the base of the brain and numbered from 1 to 12 from front to back. These connect our brain to different parts of the body but are mostly connected to the head and neck region. So they play many important roles in our overall function, especially when it comes to our senses. So let's get started. The first cranial nerve is the olfactory nerve, which sends sensory information from our nose to our brain, which gives us our sense of smell. The second cranial nerve is also sensory, called the optic nerve, and this sends sensation from our eyes to our brain, giving us the sense of sight. The third cranial nerve is the oculomotor nerve, which is a motor nerve which sends signals from our brain to our eyes mainly. So it is connected to 4 of the 6 eye muscles, including the superior rectus, inferior rectus, medial rectus, and inferior oblique muscles. The oculomotor nerve is also important for pupil constriction, so when our pupils in our eyes get smaller, as well as accommodation when we want to focus on objects in different distances. This is what's called accommodation and is done through our lens shape changing. The oculomotor nerve is also connected to the levator palpebrae muscle, which is the muscle that opens our eyelids. The fourth cranial nerve is also a motor nerve called the trochlear nerve, which connects to the superior oblique muscle in our eye, which moves our eye outward and downward. The fifth cranial nerve is the trigeminal nerve, which has both motor and sensation connections to the brain. The trigeminal nerve is important for mastication, which is basically our jaw moving, which allows us to chew our food. The tri-part of the trigeminal nerve is there to remind us that it splits into 3 parts, being the ophthalmic, maxillary and mandibular parts. The trigeminal nerve also supplies somatosensation of the front 2/3 of our tongue, as well as it's connected to the tensor tympani in our ear, which allows us to dampen loud noises when they happen. Inflammation and irritation of the trigeminal nerve can lead to trigeminal neuralgia, and patients with this condition often complain of the worst headache ever, and it's extremely painful and often leads these people to be at high risk of suicide, especially if treatment isn't working. The sixth cranial nerve is the abducens nerve, which is connected to the lateral rectus muscle in our eye, which allows our eyes to move outward. So if you've been paying attention, cranial nerves 3, 4 and 6 innervate the eye, which allows our eye to move in all of the different directions. The seventh cranial nerve is our facial nerve, which has both motor and sensation connections to the brain. The facial nerve is important for facial movement, as well as supplies taste from the front 2/3 of our tongue. The facial nerve is also responsible for lacrimation, which is the creation of tears, as well as salivation, eye closing via the orbicularis oculi, and is also connected to the smallest muscle in the entire human body called the stapedius, which is a tiny 1 millimeter muscle in the middle part of our ear. This plays a very important role as it helps to stabilize the conduction parts of our ear to actually adjust the volume of all the sounds that we hear. The eighth cranial nerve is a sensory nerve called the vestibulocochlear nerve, and this is important for our hearing and balance. Cranial nerve number 9 is the glossopharyngeal nerve, which has both motor and sensation connections to the brain. The glossopharyngeal nerve is responsible for both taste and sensation of the back 1/3 of our tongue, as well as being important for swallowing, salivation from the parotid gland, monitoring carotid body and sinus, chemo and baroreceptors, as well as being connected to the stylopharyngeus muscle, which elevates both our pharynx and larynx part of our throat, and this is very important when it comes to swallowing large bits of food. Cranial nerve number 10 is the vagus nerve, which does have both motor and sensation connection to the brain. The vagus nerve has many different roles, including parasympathetic pathways, which allow for rest and digest of our body. It's also important for taste from our supraglottic region, swallowing, soft palate elevation, talking, our cough reflex, as well as monitoring chemo and baroreceptors in our aortic arch. Our aorta being an extremely important blood vessel coming from the heart, supplying most of the body. The 11th cranial nerve is a motor nerve which connects to our sternocleidomastoid muscles in our neck, which allows our head to turn, as well as the trapezius muscle here, which allows our shoulders to shrug like this. And the 12th cranial nerve is the hypoglossal nerve, which is also motor and is important for our tongue movement. If you want to learn more about how the human brain works and how to achieve better brain health, don't forget to hit the subscribe button and hit the notification bell so you don't miss out on future videos. I hope you have a wonderful rest of your day. Keep on learning. Take care, everyone.